We're here with an episode of Gimme 5 on Friday talking about autism and EMS when it comes to peds. And so I am here with Matt Kodacek, who is the inventor of Ben's Blue Bags. And tell us, why did you actually create Ben's Blue Bags?
So the reason why I created Ben's Blue Bags is it's a two-part program of autism awareness for any level of first responders, from EMR through paramedic, police officer, or firefighter, or anybody that might come in contact or handles somebody that's on the autism spectrum disorder. The second part of it is not only the awareness and what to do, is now here's a bag that has different sensory stimulation items that hopefully help you de-escalate an autistic or special needs patient during an overstimulation event. Nice. So it's kind of a two-part program. So one part is the awareness and teaching first responders how to look for somebody, like what to look for, what triggers them, overstimulates them. And now at the end of it, here's a bag that you can use, hopefully that will help you with it.
That's awesome. And you said that you created this because your son, who's now 8, at the age of 5, was it?
Yeah.
That was diagnosed with autism.
Yeah, so I named it after my son, Ben. Being that I've grown up in the fire EMS service forever. My dad was a volunteer fireman. My brother's a paramedic chief. I'm a lieutenant with my fire department. I know what it's like to growing up in emergency services. And I wanted a bag that was very distinct, very easy identifiable. When I said, instead of just saying, go get a Sentry bag, when I said, go get the Ben's Blue bag, they're really easy to find. Rather, again, if they're stored next to the Pedi-Ed-Tric bag, if they're in a trunk of a police car or under the seat in a fire engine, that they're very easily identifiable. When you tell the crew to go get something, that they'll have no problem finding this bag. And that's why it says Ben's Blue Bags on it. It's a nice bright blue color and makes it really easily and identifiable. So the first thing I always point out is our dry eraser board.
Okay.
So dry eraser board and a package of markers.
Simple, but
very simple concept. You know, if they want to write, especially if they're nonverbal and all that. One thing I added that Ben's teacher, and his kindergarten teacher, when I kind of first started demoing this and showing it, was adding where it hurts on the back. So using the pictogram works really good. Of if they're nonverbal, they can't speak, they can at least direct us to where it hurts. So next thing I talk about is the Sentry Kit. So the Sentry Kit is about 30 some different items.
Okay.
And it's all different sensory stuff in there for the EMS or for the crew to use. With anyone on the autism spectrum, they love spinning of objects. Train wheels, gears, stuff like that. Yeah, anything, they love stuff going around. So we have 4 fidget spinners in every single bag.
Okay.
Great thing, again, they're very attracted. They love stuff that goes around. If the green fidget spinner works, give it to them. You can, it's easy to replace that stuff. Whatever works, that one thing, give it to them.
Yep.
So we have 4 fidget spinners, and then we put 2 sets of earmuffs in every single bag.
Nice.
The reason with the earmuffs is with that hypersensitivity, with the white noise, giving that stuff to drown out that white noise works really good. One of the cases I always present is one of my ambulance crews had a male in his 30s who was special needs and had his feeding tube come out. And as they were putting him in the back of the ambulance, he started getting really overstimulated from the noise of the air conditioner and all that stuff.
Okay.
One of my firefighters, he said, I goes, man, I went out and got my Ben's bags out of the truck. He goes, nothing seemed to work on this stuff. But he goes, the earmuffs. He goes, I pulled the earmuffs off, out, and he goes, the guy's eyes got really big. He goes, he snatched them out of my hands, put them on, and and then was fine. And he goes, when we took him to the hospital, he was really calmed down, so we just left him with him at the hospital.
Okay.
So it's one of those, again, if you need to leave him with the patient,
then you can do that.
do it. You know, if that's what calms them down, makes them better, then go with that.
Okay. So in essence, it kind of replaces the old teddy bears of the past.
Yeah, it's just thinking new, out of the box, and we need to kind of constantly adapt for EMS.
All right. Well, I love it, Matt. Thank you so much for showing us this. We'll put your contact information out there. If anybody wants to reach out to Matt for additional information, his QR code, you can scan that and it'll get you straight to Matt. So thank you again for being here, and we'll see you on our next Gimme 5 on Friday.